Today our will be about the cerebral cisterns and its anatomy. Uh, we will start with introduction. It's the knowledge of the detailed anatomy of the subarachnoid cistern and the neural and vascular contents of each of the cistern is important. Especially for neurosurgeon planning and execution of the intracranial procedures.
Yes.
If we want to know the anatomy and the details anatomy of the subarachnoid cistern, we should to take the basics of the subarachnoid cistern, how it's formed, what's the subarachnoid cistern. First of all, the arachnoid matter. We should to take small notes about it. The arachnoid matter covers superficially over the brain surface and bridging the gyri, as we see here. It's just like the paper covered the brain surface, the gyri, and the sulci. The biamatter is the inner layer. It's inner than the arachnoid, and it's under the arachnoid, as we say. It's covered the gyri and goes with the sulci to the inner surface of the brain. So the space between the arachnoid and the biamatter in the sulci and in these depressions is called the subarachnoid cistern. It makes like a space between the arachnoid and the biamatter. So this space which lived between the arachnoid and the biamatter is called the arachnoid cistern. There is numerous trabeculae and septi between the arachnoid matter and the biamatter. This trabeculation, which we see here between the two layers of the meninges, make like spaces and divide the spaces between the subarachnoid space and make the cistern. This space between the biamatter and the arachnoid matter, it's divided by the trabeculae, as we said before, but it's communicate with each other through the holes and opening between the trabeculae. Most of this subarachnoid cistern is distributed over the base of the brain. Sorry. Over the base of the brain and skull, as we see here in the posterior posterior part of the brain and in the skull base. So the subarachnoid cistern is filled with CSF and contains the large blood vessels and the cranial nerves. The surgical importance of this subarachnoid cistern is during operation, if we see a bulging of the brain or tension of the brain and increase intracranial pressure, just opening of the sternal cistern during surgery and allow the CSF to drain outside will make the brain relax and make the operation and the surgical corridor and approach to the lesion and tumor usually is easier than if we didn't open the cistern and relax the brain. So it's one of the methods to relax the brain to reach the lesion, the deep lesions. Also, an understanding of the anatomy of the subarachnoid cistern and their contents and boundaries is very important in the dealing with the aneurysm to allow safe surgical management. Also, the arachnoid septa and trabeculae separating the cistern decrease the spread of subarachnoid hematoma to the adjacent cistern after the aneurysm rupture. As we see here in this brain CT, axial brain CT shows hematoma in the Sylvian fissures at the left side. give us impression that there is here the lesion in this area, which is usually the middle cerebral artery aneurysm. As we make sure and confirmed by the CT, by the cath angio. Also, it provides safe and surgical extra-axial corridor to the approaches to the aneurysm and brain lesions because its spaces, we didn't go intra-axial, we go through the spaces filled with CSF and reach to the lesions, either aneurysm or brain tumors. It gives also a radiological diagnosis of brain herniation syndromes. For example, in ankle herniation, we see here this MRI shows the perimesencephalic cisterns is filled with CSF and the brainstem is relaxed. In comparison to this MRI, the CSF is the brainstem is compressed and the CSF in this cistern is empty because there is compression from the ankles to the brainstem, which gives diagnosis of ankle herniation. Also, for example, in tonsillar herniation, there is overcrowding at the foramen magnum, and the cistern here is disappeared because there is herniation. So it gives us also impression of the angle of the tonsillar herniation. Okay, we will talk shortly about the historical aspect of the subarachnoid cisterns. The Magendie gave the first modern description of the subarachnoid space as containing cerebrospinal fluid. He described the basal cisterns and the extensions of the arachnoid along the cranial nerves 2 and 5, 7, and 8. Key and Retius published a monumental work in which they presented drawing of the subarachnoid space that has been injected with blue dye, demonstrate the extension and divisions of the subarachnoid system. They showed the relationship of the cerebral vessels to the arachnoid and the numerous trabeculae, which suspended these vessels from the walls of the cistern. Dandy also described injection of air into the lumbar subarachnoid space in order to outline the cerebral ventricles. It was seen that basal subarachnoid cisterns were also demonstrated in this manner. Locke and Nafziger undertook corrosion cast study of the subarachnoid cisterns in dogs and humans, and demonstrated the shapes and intercommunication of the subarachnoid space. They gave general names to the subarachnoid cistern. Davidoff and Dyke also published a textbook on the normal mnemocephalogram, in which they discussed the shape and extension of the subarachnoid cistern in some details. Lilliquist employed both techniques to provide a working normal anatomy of the subarachnoid space. The subarachnoid cistern is divided into supratentorial and infratentorial. The supratentorial is divided into anterior, posterior, lateral, superior, and this is the name of the cisterns, which we'll talk later on in details for each one of these cisterns. The infratentorial also is divided to multiple groups. Each group, there is a lot of cisterns. Each one will be discussed later on in details. As we see in this radiology, in this sagittal view MRI, there is a lot of cisterns here. Each cistern give a roadmap to approach to certain lesions in the brain, even aneurysm or tumors, which make a safe roadmap. Before we will discuss the subarachnoid cisterns, I want to talk about the Lilliquist membrane, which is important landmark in the cerebral cisterns. The Lilliquist membrane is extended from the dorsal part of the diaphragm cilia, as we see here, from the dorsum cilia extended to and posterior clinoid process, and goes posteriorly and upward and downward and divided into two leaflets. Okay, as the membrane spreads upward from the dorsum and across interval between the oculomotor. So it originates from the posterior clinoid process, which is here, and the diaphragm and the dorsum part of the cilia, and goes backward between and spread between the two oculomotor nerves from this side to this side, and goes posteriorly. As it goes posteriorly, it's divided into two leaflets. Superior leaflet, which is called the diencephalic membrane, and inferior leaflet, which is called the mesencephalic membrane. The diencephalic membrane, it extends from the dorsum of the cilia and goes upward and posteriorly to attach to the dorsal part of the mammillary body. As we see in this MRI, it extends from the dorsal part and goes posteriorly to attach to this part of the mammillary body. It separates this diencephalic membrane. It separates the chiasmatic cistern from the interpeduncular cistern. As we see, this is the chiasmatic cistern, and this is the interpeduncular cistern. Also, as we see here, this is the chiasmatic cistern. Below it is the interpeduncular cistern. The membrane between these cisterns and separate these cisterns is called the diencephalic membrane of the Lilliquist membrane. It's characterized by that it's thick. The diencephalic leaflets of the Lilliquist membrane is thick and separates the interpeduncular from the chiasmatic, and didn't allow the passage of the air from the interpeduncular to the chiasmatic system. The mesencephalic membrane, it extends backward, as we talked before, from the dorsum cilia, from the dorsal part of the cilia, posteriorly to the junction between the midbrain and the bone. It separates the interpeduncular system from the prepontine system, but it's thinner. It is thinner than the, as we note here, this is the diencephalic, and this is the mesencephalic. The mesencephalic is a thinner membrane, and it's fenestrated and allow the basilar artery to pass through this membrane. Okay, we will talk and discuss the first one. First one of the cistern is the cisterna magna. Okay, the cisterna magna is the lowest part of the cisterns. It's located posterior to the lower part of the medulla oblongata and the upper spinal cord. As we see here, this is the posterior view of the cerebellum and upper part of the spinal cord. This is the cistern, which is covered by the arachnoid membrane and filled with CSF. It's bordered anteriorly by the and the dorsal surface of the spinal cord and lower medulla. As we see here, this is the lower part of the medulla, and the upper part of the spinal cord makes the anterior border of the cisterna magna. Anteriorly, it opens to the cerebellopontine cistern. So from the cisterna magna opens from this side to the cerebellomedullary cistern. The posterior border of the cisterna magna is the arachnoid membrane, which cover the inner part of the dura of the from the occipital bone, the arachnoid, which cover the inner surface of the occipital bone and the dura hair. Posteriorly, it communicates with the cerebellar incisura. The superior border of the cisterna magna, as we see here, the superior wall or the superior border of the cisterna magna is the caudal part of the cerebellum. The communication between the cisterna magna, as we see here, it communicates superiorly with the fourth ventricle through the central foramen of the fourth ventricle, which is the foramen Magendie. The inferior communication between the cisterna magna and the posterior spinal cistern. So the communication, as we talked, there is communication anteriorly, superiorly, and anteriorly, and to the posterior spinal cistern inferiorly. The contents of the cisterna magna is the pica, posterior inferior cerebellar artery. As it branch from the vertebral artery, it goes posteriorly and through the cisterna magna. In the cisterna magna, it divides into two branches. The first branch is the medial trunk, which supplies the vermis, and the lateral branch, which supply the cerebellar surface. There is surgical and anatomical and practical importance of the cisterna magna in the cisternal tap. If we want to talk a CSF sample in approach rather than the lumbar puncture, we can take from cisternal tap, which is a percutaneous suboccipital access to the cisterna magna. It's usually done by 22 gauge spinal needle is inserted exactly in the midline between the inion and the C2, directed superiorly toward the glabella. The needle usually either strikes in the occipital bone or goes directly to the cisterna magna, and the CSF can be taken. The second cistern is the cerebellomedullary cistern. The cerebellomedullary cistern has another name. It's the inferior cerebellopontine cistern, because there is some authors and anatomists divide the cerebellopontine cisterns into superior and inferior, and the other divide into cerebellopontine cistern, which which we will discuss later on, and the cerebellomedullary cistern. So the cerebellomedullary cistern extends backward from the dorsal margin of the inferior olive around the dorsal medulla to the biventral lobule of the cerebellum. So it's extended from this dorsal part of the inferior olive posteriorly to the biventral lobule of the cerebellum. As you see here in this anterior image of this dissection, this is the olive. It's just located just posterior and dorsal to the olive. This posterior view of the cerebellum and the brainstem. As we see here, this is the cerebellomedullary system. It's bounded superiorly by the junction of the bones and medulla. Here, it's located just below this line between the bones and medulla. In the superior border, it's divided from the cerebellopontine system by the lateral pontomedullary membrane. The anterior border of the cerebellomedullary system is the dorsal margin of the inferior olive, as we talked. Just here, this is the inferior, this is the dorsal part of the olive. It's just located dorsal to it. This is another picture. It's just located dorsal. So the anterior margin or the anterior border of the cerebellomedullary system is the dorsal margin of the inferior olive. Also anteriorly separated from the premedullary system by the rotlets of the vagus and glossopharyngeal nerve and accessory nerve. As we see in this image, this is the glossopharyngeal and the vagus, and this is the accessory medullary part of the accessory nerve. Posteriorly is the biventral lobule of the cerebellum, which we see here. Okay, the inferior border of the cerebellomedullary system is the junction of the spinal cord and the medulla at the level of the foramen magnum. It communicates with the lateral recess of the fourth ventricle. The cerebellomedullary system is communicate here with the fourth ventricle through the foramen of Lashka in each side. The contents of the cerebellomedullary system is the glossopharyngeal and vagus nerves. As we see in this MRI, this is the rotlets and this is the nerves for the glossopharyngeal. And this other, this is the vagus and the glossopharyngeal just. Also, this is the medullary branch or the medullary part of the accessory nerve. Also, it's contained within the cerebellomedullary system. Also, one of the contents of this system is the choroid plexus that projects from the foramen of Lashka, from the fourth ventricle to the this system. As we see here, it just go from the fourth ventricle through the foramen of Lashka to this system. Also, one of the important content of this system, of the cerebellomedullary system, is the vertebral artery. As the vertebral artery penetrates the dura to become intracranially and intradural inside the dura, it penetrates the dura at this cistern, at the level of this cistern, to become from the intradural, from the extradural branch to the intradural part. As you see in this picture, this is the lamina of C1. This is the arch of the vertebral artery, goes to the penetrate the dura at the foramen magnum at this cistern. Also, this picture shows after we open the dura, that the vertebral artery goes through the foramen magnum, penetrate the dura, become intradural. Also this dissection image. Also, one of the contents of the cerebellomedullary cistern is the pica. As it originates from the vertebral artery, it start to branch from the cerebellomedullary cistern and goes to the cisterna magna. Also, the other cistern is the premedullary cistern. The premedullary cistern just located just anterior to the medulla, as we see in this MRI. The anterior to the medulla is this space filled with CSF is called the premedullary cistern. Also in this axial view, this is the yellow one is the premedullary cistern. It's bounded anteriorly by the arachnoid membrane, which cover or line the inner part of the clavus. It lines the posterior part of the clavus. This is the clavus. This is the dura, and the inner part of the arachnoid is the anterior border of the premedullary cistern. Also in this MRI, you see here. The posterior border of the premedullary cistern is the anterior surface of the medulla oblongata. Posterior laterally is the rotlets forming the hypoglossal nerves arise between the medullary pyramids and the inferior olive. As we see in this picture, the rotlets of the hypoglossal nerves, and this is the pyramid, the olive hair, the origin of the hypoglossal between them. This picture, I think, is more clear. This is the origin of the hypoglossal nerve between the olive hair and anterior, just anterior to it is the pyramid. The origin of the hypoglossal nerve is here between the pyramid and the olive, and makes the posterior lateral border of the premedullary cistern. The superior border of the premedullary cistern is the junction of the bones and medulla. It's separated from the prepontine cistern by the medial pontomedullary membrane. So between the bone and the medulla, there is a membrane here which separates the premedullary cistern from the prepontine cistern. The inferior border of the premedullary cistern, it opens directly to the anterospinal cistern. From the premedullary cistern, the CSF is communicate between the anterospinal cistern and the premedullary cistern. Also, we see in this MRI, this is the CSF in front of the spinal cord, which is called the anterospinal cistern, and this is the premedullary cistern. The contents of the premedullary cistern is the vertebral arteries. As we see here, the vertebral artery arises from the enter the spinal, the intracranial cavity and the intradural cavity through penetration of the dura, as we talked before, in the cerebellomedullary cistern, and goes anteriorly and turn to the premedullary cistern. Also, it contains the anterospinal artery. The anterospinal artery originate from the vertebral artery, from both vertebral artery, and communicate with each other to form the anterospinal artery. Also, it contains the origin of the basilar artery. the vertebral artery inside the premedullary cistern, each one in the side, one in the left and one in the right, communicate with each other at the center to form the basilar artery at the upper border of this cistern. So the basilar artery is formed by a union of the left and right vertebral artery at the junction of the premedullary and prepontine cistern. The next cistern is the cerebellopontine cistern. The cerebellopontine cistern is located here, just anterior lateral to the bones, between the bone and the cerebellum. It extends between the anterior lateral surface of the bones, as we see in this MRI, and the cerebellum. It's bounded superiorly by at the level of the tentorium. It's separated from the ambient cistern by the lateral pontomesencephalic membrane. So just above to it is the ambient cistern, which is separated from it by the lateral pontomesencephalic cistern. Here. The inferior border of the cerebellopontine cistern is the junction of the bones and medulla oblongata, separated from each other by a membrane called called by the lateral pontomedullary membrane. The anterior border or boundary of the cerebellopontine cistern is the membrane spans between the interval between the posterior cerebral artery and the superior cerebral artery. As we see here, this is the superior cerebral artery, superior cerebellar artery and posterior cerebellar artery. The membrane spread between these two arteries make the anterior border of this cistern. Also, as we see here in this picture, this is the posterior cerebral, superior cerebellar. The artery spread between the membrane spread between these two arteries make the anterior boundary of this cistern. Medially is separated from the prepontine cistern by the anterior pontine membrane. So in the anterior part of this MRI is the prepontine cistern. Just posterior lateral to it is the cerebellopontine cistern. The separation and the membrane which separates these two cistern is the anterior pontine membrane. The lateral border of this cistern, of the cerebellopontine cistern, is the cerebellar surface wraps around the bones from the cerebellopontine fissure. So this part of the cerebellum which form the cerebellopontine fissure make the lateral border of the cerebellopontine cistern. Also, the lateral wall or the lateral boundary of the cistern is the posterior vitreous portion of the temporal bone. As we see in this MRI, this is the vitreous part, the posterior part of the vitreous bone, make the lateral boundary of the cerebellopontine cistern. Through this lateral wall is the internal auditory meatus, which extending outward into the Michael's cave. The contents of the cerebellopontine cistern is the trigeminal nerve. The trigeminal nerve arises from the anterior border of the mid bones and course through the superior lateral, sorry, the superior lateral portion of the cistern. As you see in this MRI, it extends from the anterior part of the bones and goes superior laterally to the Michael's cave. The abducent nerve also arises from the fissure between the medulla oblongata and the bones and goes anteriorly. It ascends just lateral to the anterior pontine membrane. The facial and vestibular nerve, also one of the contents of the cerebellopontine cistern, as it arises from the lateral part of the pontomedullary sulcus, both. This is the facial, this is the vestibulocochlear nerve. Also, one of the contents of the cerebellopontine cistern is the folliculus of the cerebellum. It just projects into the cerebellopontine cistern just behind the facial and vestibulocochlear nerve origin. This is the folliculus. This is the origin of the vestibulocochlear and the facial nerve. It's just located behind it. Also, we see in this MRI, this is the folliculus located within the cistern. The cerebellopontine cistern also contains the superior cerebellar artery, as it originates and branches from the basilar artery. You see here, it originates from the basilar artery within this cistern. Also, as we see here, this is the superior cerebellar artery, originates from the basilar artery and goes through the this cistern. The superior cerebellar artery course above the trigeminal nerve, as we see here. This is trigeminal nerve, this is superior cerebellar artery. Below the fourth nerve and the lateral pontomesencephalic membrane. This is the fourth nerve. Yes. This is the fourth nerve, cochlear nerve, and this is superior cerebellar artery between the fifth nerve and the fourth. Also, it contains the ICA. This is the ICA, originate from the basilar artery at this cistern. It enters the lower part of the cistern by passing through or below the anterior pontine membrane. The next cistern is the prepontine cistern. The prepontine cistern just located anterior to the anterior surface of the bones. As we see in this MRI sagittal view, this is the anterior surface of the bones. Just anterior to it is space filled with CSF and contains the basilar artery. This is the prepontine cistern. It extends between the anterior surface of the bones and the arachnoid membrane covering the inner surface or the posterior wall of the clavus. As we see in this image, this is the clavus. This is the posterior part of the clavus. This is the arachnoid, which line the inner surface. And this is the anterior surface of the bones. This space filled with the CSF and contain the basilar artery is called the prepontine cistern. It's bounded superiorly by the mesencephalic leaflets of the Lilliquist membrane. So the Lilliquist membrane is the inferior leaflet of it is separate the prepontine cistern from the interpeduncular cistern. As we see in this image, this is the prepontine cistern, this is the interpeduncular cistern. Between it is the inferior leaflet of the prepontine of the Lilliquist membrane. Okay, the inferior boundary of this of the prepontine cistern is the junction of the bones with the medulla. It's separated by the medial pontomedullary membrane. So just below the prepontine cistern is the premedullary cistern, separated by a thin membrane is called the medial pontomedullary membrane. Okay. The lateral border of the prepontine cistern is the cerebellopontine cistern, which is here is the prepontine cistern. Here is the cerebellopontine cistern, separated by a thin membrane. Here is called the anterior pontine membrane. The contents of the prepontine cistern is the basilar artery. The basilar artery just formed at the junction of the premedullary cistern and the prepontine cistern, and pass through this cistern superiorly and gives rise to the ICA within this cistern. So the next group of cisterns is called the premesencephalic cistern. Its 4 cisterns surround the midbrain and the mesencephalon. The first cistern is called the interpeduncular cistern, which is located anterior to the midbrain between the 2 peduncles of the midbrain. The next is the quadrigeminal cistern, which is located just dorsal to the midbrain. Posterolateral is called the ambient cistern. Anterolateral is the cororal cistern. So in this MRI, as we see, this is the interpeduncular cistern, this one. The next is the quadrigeminal cistern. This is the just located posteriorly or dorsal. Posterolateral is the ambient. Anterolateral is the cororal cistern. Also, this is the brain, this is the midbrain. Just anterior between the 2 peduncles is the interpeduncular. Just lateral to it is the cororal. Posterolateral is the ambient, and dorsally is the quadrigeminal. The interpeduncular cistern as we see in this picture, this is the midbrain and this is the 2 peduncles. Between the 2 peduncles is the interpeduncular cistern. It just lay above the anterior portion of the tentorial incisura. So this is the tentorial incisura. Just above it is the interpeduncular cistern. The borders, it's bounded laterally by the cerebral peduncles. Also, the oculomotor is located at the lateral wall of the interpeduncular cistern. It runs in the lateral wall and forms the pillar to which the leaves of the Lilliquist membrane attach. So the Lilliquist membrane, it originates from the dorsal part of the cella and spread between the two oculomotor nerves as it goes posteriorly and divide into two leaflets. Laterally, it opens laterally to the ambient and choroidal system, as you see here. It opens to the choroidal and ambient system laterally. The superior border of the interpeduncular cistern is the superior leaflets, or called the diencephalic leaflet of the liliquous membrane, which separate the interpeduncular cistern from the chiasmatic cistern, as we will talk later. Also, the superior border is the posterior edge of the mammillary body. As we see here, the liliquous membrane is originate from the dorsal part of the sella and goes back and superiorly to the dorsal edge of the mammillary body. This is this membrane separates the chiasmatic cistern from the interpeduncular cistern. This picture is more clear as it's spread from the dorsal part of the sella to the mammillary body. Inferior border of the interpeduncular cistern is the mesencephalic membrane of the liliquous membrane. So the liliquous membrane, the inferior leaflets of it, or mesencephalic leaflets, separates the interpeduncular cistern from the prepontine cistern. The inferiorly, the mesencephalic liliquous membrane and the junction of the midbrain and bone. The anterior inferior border of the interpeduncular cistern is the upper part of the clavus. The contents of the interpeduncular cistern is the bifurcation of the basilar artery. As we talked before, it's formed at the junction of the premedullary and prepontine and just bifurcates at the upper border of the interpeduncular cistern after leaving the prepontine cistern. Also, it contains the origin of the posterior cerebral arteries. As you see here, this bifurcation and the posterior cerebral artery and the superior cerebral artery contains one of the content of the interpeduncular cistern. Here, as you see, the origin of the superior cerebral artery and the bifurcation of the basilar artery. Also, one of the contents of the interpeduncular cistern is the basal vein of Rosenthal, as you see in this CT angio. The next cistern is the ambient cistern, which is located just at the posterior lateral surface of the midbrain here. It's bounded medially is the lateral wall of the mesencephalon. As you see here, this is the medial border and part of the cerebral peduncles. Laterally is the supratentorial, in the lateral wall or the lateral border of the ambient cistern. There is supratentorial, which is the mesial temporal lobe, as you see here. This part of the mesial temporal lobe makes the lateral wall of the ambient system. As you see in this MRI, this is the lateral wall, which is the mesial temporal lobe. Also in this coronal view. In the infratentorial part of the ambient system, the lateral wall is formed by the the lobulus quadrangularis of the cerebellum, which is here as it's appear here. So the lateral wall of the ambient system, there is infratentorial and supratentorial. The infratentorial part is the lobulus quadrangularis of the cerebellum, while the supratentorial is the mesial temporal lobe. The inferior border or boundary of the ambient system is the arachnoid wall with the cerebellopontine system. Which separates the ambient from the cerebellopontine thin membrane. The anterior boundary of the ambient system is the choroidal system. Just anterior to it is the choroidal system. It contains the contents of this system is the posterior cerebral artery, as you see here. Also, the basal vein of Rosenthal, as you see in this CT angio. This is sorry, MRI. This is the basal vein of Rosenthal. As it goes to the to form the great vein of Galen. The next system is the choroidal system. The choroidal system is bounded medially by the cerebral peduncle. This is the cerebral peduncle, which make the medial border of the choroidal system, while the lateral border is the hippocampal gyrus. Anteriorly is the carotid system. As you see, this is the choroidal system. Just located anterior to it is the carotid system. Also, this is the choroidal. Anterior to it is the carotid system. Posteriorly is the ambient system. The contents of the choroidal system is the anterior choroidal artery. This is the anterior choroidal artery. Located within this space is the choroidal system. The medial posterior choroidal artery also is contains within the choroidal system here. This is the midbrain. Here is the posterior cerebral medial posterior choroidal artery. Also, it contains the basal vein of Rosenthal. As we see here, this is the basal vein of Rosenthal, extend from the coronal to the ambient system, finally to the quadrigeminal system to join to form the great vein of Galen. The quadrigeminal system located at the dorsal part of the mesencephalon. As you see here, it's bounded anteriorly by the dorsal mesencephalon. This is the quadrigeminal system. It's bounded anteriorly by the dorsal mesencephalon and the quadrigeminal plate and the pineal gland. This is the pineal gland, this is quadrigeminal, and the dorsal part of the mesencephalon. Here is the quadrigeminal system. This is the quadrigeminal. and its boundary anteriorly. The posterior boundary of the quadrigeminal cistern is the arachnoid membrane extends between the tentorium and the splenum of the corpus callosum and extends to the lingula of the cerebellar vermis from the splenium to the tentorium. Also, from the splenium to the tentorium makes the posterior border of the quadrigeminal cistern from here to here. Also posteriorly, the part of the occipital cortex located below the splenium makes also one of the posterior boundary of the quadrigeminal cistern. The superior boundary of the quadrigeminal cistern is the broad membranous envelope that surrounds the great vein and its tributaries. So also this makes the superior boundary of the quadrigeminal cistern and the lower surface of the splenium. From here to here is the superior boundary of the quadrigeminal cistern. It opens to the velum interpositum cistern, which is located just anterior to it. We will talk later on about it. Inferiorly, the superior medullary velum of the fourth ventricle, which is located here. Here is the superior velum of the fourth ventricle, makes the inferior boundary of the quadrigeminal cistern. Laterally, it opens to the ambient cistern. From this quadrigeminal cistern, it opens to the ambient cistern, which is located laterally. The contents of the quadrigeminal cistern, number one is the great vein of Galen and its tributaries, the internal cerebral vein and the basal vein of Rosenthal. See here, this is the internal cerebral vein, basal vein of Rosenthal, join each other to form the great vein of Galen. Also, the contents is the posterior cerebral artery, commonly bifurcates into the calcarean and the parieto-occipital branch at this cistern. Here. Also, it contains the trochlear nerve, arise just below the inferior colliculus. As we see here, this is the superior colliculus, this is the inferior colliculus. The fourth nerve, fourth cranial nerve, the trochlear nerve, originates just below it within the quadrigeminal cistern. Also, in this cross section, this is the trochlear nerve, originates from the dorsal of the midbrain and goes anteriorly to the ambient cistern. The next cistern is the carotid cistern. This is the carotid cistern. Sorry. This is the carotid cistern, which contains the internal carotid artery. The boundaries of this carotid cistern, the superior boundary is the dura over the anterior clinoid process. So this is the anterior clinoid process, just the dura make the superior boundary of the carotid cistern. This is the internal carotid artery within this cistern. And this is the internal carotid artery, the anterior clinoid process. The dura makes the superior boundary of the carotid cistern. Also, the optic nerve make the superior boundary of the carotid cistern. As we see here, this is the internal carotid artery as it goes superiorly within the carotid cistern. The orbitofrontal loop makes the superior boundary also of the carotid cistern. The carotid cistern bounded inferiorly by the cavernous sinus, which is located here. Laterally is the medial temporal lobe and the free margin of the tentorium, which is located here. This is the carotid cistern. Just lateral wall is the temporal lobe and the free margin of the tentorium. Here, the carotid artery. This is the medial temporal lobe, and this is the tentorial edge. The medial boundary is the chiasmatic cistern. So, just medial to the carotid cistern is the chiasmatic cistern. We will talk later about it. The medial carotid membrane also, as we see here. This is the carotid artery. Just lateral to it is the chiasmatic cistern. The contents is the supraclinoidal portion of the internal carotid artery. It contains within the carotid cistern. And the origin of the ophthalmic artery, as it originates from the internal carotid artery. It's located within this cistern. Also, it contains the posterior communicating artery, as it originates from the internal carotid artery, and the anterior choroidal artery. This is the posterior communicating. This is the anterior choroidal artery, as it originates from the internal carotid artery. The next cistern is the chiasmatic cistern. It's located just medial to the carotid cistern. It's bounded superiorly by the optic nerves and chiasm. It makes the roof of this cistern. Both the optic nerves here anteriorly and the chiasm, and it's located here. This is the cistern from picture from above, just below the chiasm and the optic nerves. Superiorly, it communicates with the inferior part of the lamina terminalis cistern. So this is the optic chiasm. Just above it is the lamina terminalis cistern, and below is the chiasmatic cistern. Inferiorly, the liliquist membrane makes the border and the boundary between the interpeduncular and the chiasmatic, as we see here in this image. This is the diencephalic leaflets of the liliquist membrane. Separates the interpeduncular below this membrane from the chiasmatic cistern here. Anteriorly is the limbus sphenoidale here, which located just anterior to the chiasmatic groove, makes the anterior border of this cistern. Laterally, shares common wall with the carotid cistern, which is the mesial temporal lobe and the free edge of the tentorium. Anterior-inferiorly, the infundibulum and pituitary stalk, and it's bounded by the diaphragma cilia. The contents of the chiasmatic cistern is the optic nerves, as located within this cistern, this one, it's got, and the pituitary stalk, the ophthalmic artery. Okay, the next cistern is the lamina terminalis cistern, which is located just above the chiasmatic cistern. Here is the chiasmatic cistern. Just above to it is the lamina terminalis cistern. Here, as we see, this is the cistern of the lamina terminalis. This cistern is defined primarily by the anterior cerebral arteries. As you see here, this is the chiasm, which form the inferior boundary and separates the chiasmatic cistern from the lamina terminalis cistern. Located within this cistern is the anterior cerebral artery. The anterior inferior boundary of the lamina terminalis cistern is the optic chiasm. Here. As we talked before, it communicates with the chiasmatic cistern just below to it. Anterior superiorly is the rostrum of the corpus callosum. Here is the corpus callosum, just above, make the anterior superior boundary of the lamina terminalis cistern. So this space is called the lamina terminalis cistern. Posteriorly is the lamina terminalis. Here is the lamina terminalis. The lateral border of the lamina terminalis cistern is the thickened bands arachnoid running from the olfactory area to the optic nerve. Here, between the olfactory and the optic nerve, there is a thickened band makes the lateral border of the lamina terminalis cistern. The contents of the lamina terminalis is the anterior cerebral arteries and the A2 proximal part just only, and the ACOM. Also, the recurrent artery of Huguenot contained within the lamina terminalis cistern. This is the recurrent artery of Huguenot. Here, this picture shows this recurrent artery of Huguenot and the A1 and the just proximal part of the A2 and the ACOM. The olfactory cistern is just located below the undersurface of the frontal lobe. Form the arachnoid over the olfactory tract between the orbital gyri laterally and the gyrus rectus medially. Between this and this. As you see here, this is the olfactory cistern. The boundary inferiorly, rostrally by the floor of the anterior fossa, cribriform plate of the ethmoid bone, makes the inferior boundary of the cistern, and caudally by the chiasmatic cistern, just posterior to it, and anterior is the cribriform plate. Posteriorly, it joins several other cisterns above the internal carotid artery bifurcation. The contents is the olfactory bulb and tract. Yeah. Parts of the frontoorbital and olfactory arteries. The olfactory arteries and frontoorbital arteries. Also, it contains several frontobasal veins. The next cistern is the Sylvian cistern. The cistern extends from the origin of the middle cerebral artery as it reaches to open to the Sylvian fissure. As you see here, after bifurcation of the carotid artery, it goes laterally through M1 through the Sylvian cistern and it opens laterally to the sylvian fissure. The cistern narrows superiorly as the frontal and temporal lobes approach, as you see here. This is the cistern. Then narrows as it goes laterally. The contents is the middle cerebral artery and its bifurcation. You see here. The superficial and deep sylvian veins contained within this cistern. Also, the velum interpositum cistern. See here. This is the velum interpositum cistern. It extends from the hypnoid commissures to the foramen of Monroe, from the hypnula of the thalamus to the foramen of Monroe. This is the cistern here at this space. As you see here, from this commissure. Go ahead. This is the hypnular commissure and goes anteriorly to the foramen of Monroe. It bounded superiorly by the spleen of the corpus callosum here, and the fornix and the hippocampal commissure. Inferiorly, it's bounded by the roof of the fourth ventricle, of the third ventricle, sorry. This is the roof of the third ventricle. It makes the inferior border of the velum interpositum cistern. Posteriorly, it's bound by the quadrigeminal cistern. Here is the quadrigeminal cistern. It communicates with the velum interpositum cistern. Anteriorly, makes it bounded by the roof of the third ventricle, and the foramen of Monroe makes the anterior border of the velum interpositum cistern. The contents is the medial posterior choroidal artery and the internal cerebral vein, as it goes medially to the internal cerebral veins, as it goes posteriorly to communicate with the basal vein of Rosenfeld to make the great vein of Galen. Also, the corpus callosum cistern, which extends just above the corpus callosum at each side of the falx cerebri. It bounded medially by the falx. This is the falx makes the medial border for each one of the corpus callosum cistern, and laterally by the pia over the cingulate gyrus from left and right side. Superiorly is the inferior edge of the falx cerebri. The inferior part of the falx cerebri makes the superior border of the corpus callosum cistern. As you see here, this is the falx. This is the cistern just above the corpus callosum. Anteriorly, it joins the lamina terminalis cistern. Here is the lamina terminalis cistern, communicate with the corpus callosum cistern. Lamina terminalis communicates with the corpus callosum cistern at the rostrum. Just here. Posterior-inferiorly, the cistern joins the quadrigeminal and velum interpositum cisterns at the end of the splenium. The contents of the corpus callosum system is the precallosal artery, the branch of the anterocerebral artery. As you see, the anterocerebral artery, as it goes through the corpus callosum system and divides into the precallosal artery. The origins of the frontopolar and calloso-marginal branch of the anterocerebral artery. The anterior and posterior precallosal vein also joins the inferior sagittal sinus, and this here, this one. This is the inferior sagittal, and this is the anterior precallosal vein. Thank you for your attention.
Thank you very much for Dr. Esmail. It's very nice lecture and very complicated and difficult. Any question for Dr. Esmail? Did you hear me?
Yes, we hear you.
Yes, any question for him?
Just a comment, please.
Yes.
Hello.
Thank you.
Doctor,
Yes.
how are you?
Hello. I just want to say a comment.
Yes, yes, you can.
First of all, very nice lecture and very important. In my experience, to know the cisterns is very important to go through several kinds of tumors and also vascular lesions. And I think that it's like a magic action to know and to open cisterns because liberation of cerebrospinal fluid, but not also that, because you can open several scissors, and if you go through the arachnoid and open it, is like a magic action. So congratulations, this lecture very much to me, and I think it's very, very important to know the surgical anatomy of brain systems. Thanks.
Thank you, Dr. Victor.
Thank you very much for all of you.
Also, greetings from Mexico City.
Thank you, thank you. And from Yemen.
Nice job. And as you said, brain systems are like the highways for the brain lesions. So it's very, very important to know their anatomy. So, Dr. Muhammad, please, you can conclude our session. You can say the final remarks, final words.
Thank you very much for all of you.
Okay, thank you all for attention.
I can't hear you.
Thank you all, everyone. We will conclude our module 2, and for certificates will be sent to everyone within 2 weeks from now, inshallah. And regarding module 3, announcement will be done within this month, inshallah, after we prepare the schedule. So thank you everyone for attending, and thank you Dr. Esmail for this nice presentation. Thank you, Dr. Muhammad, for your work as a moderator with us. And thank you very much, Professor Doctor, for your attendance with us today. And see you all, inshallah, next time, inshallah.
Inshallah.
Thank you all.
Thank you.